Ever pondered over the term low blood pressure? Let's dive a little deeper into the topic. Blood pressure is measured using millimeters of mercury, and any reading lower than 90/60 is considered low or hypotensive. However, it's not always a cause for concern unless it's presenting symptoms. Lack of sufficient blood supply to the organs due to low blood pressure can lead to critical conditions like shock, stroke, heart attack, or kidney failure. However, the good news is that many individuals with low blood pressure do not require medications or medical interventions. Instead, certain natural remedies and lifestyle changes can help raise the blood pressure levels. One of these remedies is consuming more salt. Yes, you heard it right. While low-sodium diets aren't ideal for everyone with blood pressure issues, a moderate increase in sodium intake can help raise blood pressure. Foods like olives, bacon, pickles, soy sauce, and certain condiments can be included in the diet. But remember, too much salt can also lead to high blood pressure, so keep it balanced. Another remedy is to limit alcohol consumption. Alcohol can lower blood pressure for up to 12 hours after drinking, so it's better to avoid it in excessive amounts. If you started a new medication and suddenly started experiencing symptoms of low blood pressure, it's worth discussing this with your doctor. Certain drugs like beta blockers, tricyclic antidepressants, and narcotics can cause low blood pressure as a side effect. A simple act like crossing your legs while sitting can also help increase blood pressure. It's an easy and effortless way to help manage your symptoms. Drinking more water can increase blood volume and help avoid dehydration, both beneficial for those dealing with low blood pressure. Similarly, eating smaller, frequent meals throughout the day can prevent a drop in blood pressure that's often associated with eating larger, heavier meals. Another remedy is wearing compression stockings. These help reduce the amount of blood that gets trapped in the lower legs and feet, thereby relieving pressure and pain associated with varicose veins. Finally, avoid sudden position changes. Rapidly sitting or standing up can cause a sudden drop in blood pressure, leading to lightheadedness, dizziness, or even fainting. To sum it up, low blood pressure is not always a problem unless it's causing symptoms. Several natural remedies can help manage these symptoms, including a moderate increase in salt intake, limiting alcohol, discussing your medications with a doctor, crossing your legs while sitting, drinking more water, eating smaller meals more frequently, wearing compression stockings, and avoiding sudden position changes. Here's to your health.
What causes low blood pressure? This is a question that has intrigued medical professionals and patients alike for years. Low blood pressure, or hypotension, can occur for a myriad of reasons, and understanding the root cause is crucial for effective treatment. Orthostatic hypotension, for instance, is a condition that arises when you stand up too quickly, and your body fails to compensate with increased blood flow to your brain. On the other hand, diseases of the central nervous system, such as Parkinson's disease, can also lead to low blood pressure. In these cases, the effects of hypotension may be felt after eating, as the digestive system requires more blood to process food. Low blood volume, whether due to severe injuries or dehydration, is another common cause of low blood pressure. Life-threatening conditions such as arrhythmias, pulmonary embolism, heart attacks, and collapsed lung can also result in hypotension. Similarly, allergic reactions and immune responses to severe infections can cause your blood pressure to drop. Heart and lung conditions can also induce hypotension. If your heart beats too quickly or too slowly, or if your lungs aren't functioning correctly, you might experience low blood pressure. Prescription medications for high blood pressure, heart failure, erectile dysfunction, neurological problems, and depression can also cause hypotension. Recreational drugs and alcohol can have a similar effect. Pregnancy may also lead to orthostatic hypotension, especially during the first and second trimesters. Complications or bleeding during pregnancy can further contribute to low blood pressure. Even extreme temperatures, both hot and cold, can influence hypotension. Understanding the potential complications of low blood pressure is just as important as knowing its causes. Hypotension can lead to falls and related injuries due to dizziness and fainting. It can also result in shock, organ damage, and even heart problems or stroke, as low blood pressure forces the heart to pump harder and faster. Diagnosing hypotension is relatively straightforward. A simple blood pressure reading can confirm it. However, identifying the underlying cause requires a more comprehensive examination by a healthcare provider, especially if symptoms are present. To summarize, low blood pressure can be caused by a variety of factors, from standing up too quickly to heart and lung conditions, to certain medications and extreme temperatures. Understanding the potential complications of low blood pressure is just as important as knowing its causes. Hypotension can lead to falls and related injuries due to dizziness and fainting. It can also result in shock, organ damage, and even heart problems. Or stroke, as low blood pressure forces the heart to pump harder and faster. Diagnosing hypotension is relatively straightforward. A simple blood pressure reading can confirm it. However, identifying the underlying cause requires a more comprehensive examination by a healthcare provider, especially if symptoms are present. To summarize, low blood pressure can be caused by a variety of factors, from standing up too quickly to heart and lung conditions, to certain medications and extreme temperatures. The complications of hypotension can be severe, including falls, organ damage, and even heart problems or stroke. If you suspect you may have low blood pressure, it's crucial to seek medical advice to identify the underlying cause and begin appropriate treatment.